This group presentation is Personal Health Records, presented by Amelia Monteleone, Jennifer Hu, Stacy King, Corey Gibbons, and Valerie Johnson. First, we're going to start off with two scenarios. These scenarios will indicate and show just how important having a personal health record is. Scenario 1 is a 56-year-old man who was admitted to the emergency department at 9 p.m. with severe abdominal pain and was taken to the OR for an emergency appendectomy. He was taken to the ICU post-op on the ventilator. He developed atrial fibrillation with heart rate 160. A cortisone drip was initiated. No family was available and full history was not obtained prior to surgery. Patient was not able to respond to questions due to sedation. The doctor asked the nurse if patient had a history of the AFib. The nurse's response was, "I did not see anything on the chart." Patient did great overnight. His rhythm changed back to sinus rhythm and he was removed from the ventilator at 11:15 a.m., but still was drowsy. A telephone order was obtained for DVT prophylaxis of Lovenox and given at 10:50 a.m. It is now 3 p.m. and patient is vomiting blood and admitted that he had a history of GI bleed. He had a bedside scope procedure and the bleeding was cauterized. It's now 5:55 and patient is stable without any further bleeding. His hemoglobin remains stable. Scenario 2 is based on a true story that occurred 2 years ago. A woman who arrived at an emergency room in Wisconsin complained of chest discomfort and soon slipped into a coma. The woman was a single mother with no family members nearby. Thanks to the detailed accounts of her health she had posted on her Facebook and her son's mention of the account, doctors were able to tap into a wealth of vital knowledge on her health. She had posted her medications, symptoms, hospitalizations, and conditions for months. She had dates, times, and descriptions of how she felt and what was occurring with her body. This personal chronicle of her health was far more complete than her medical records could have possibly been. She made a complete full recovery. It makes us wonder and question how our own personal health record and of those we care about would fare in an emergency situation. These scenarios had one common factor that was essential and vital to each patient. Can you name it? Personal health record. This presentation will address the following questions. What is personal health record? Why use PHRs? What can a PHR contain? What are the benefits of PHRs? Are PHRs private and secure? How can a healthcare provider obtain a patient's PHR? Types of PHR to mention, what choices of PHR providers are available, 12 questions to ask when choosing a PHR, listing of PHR vendors that are available, links of a few mobile PHR apps, where to go and get started on a PHR. What is a personal health record? A personal health record is a health record organizer that can be used to track and access information about a person's past and current health history. PHRs are not used as a legal medical record. A PHR may include several things. Health record organizer. This includes history, list of medications, immunizations, imaging, laboratory test results, calendar and reminders, appointments, preventive schedules, daily health routines, communication portal, online consults, prior authorizations, benefit queries. A PHR may also include cost management tools, tracking services and costs, budgeting of HSA, definitions of benefits, incentive programs, points for wellness and assessments, preventive programs, maintenance timelines, and health education, disease management programs, references on tests and procedures. Why use PHRs? Easy access to personal health records so that providers will be able to initiate care and order treatments in a timely manner. Avoid duplicate tests and procedures. Keep personal health information current. Get prescription refills. Email physician. Schedule appointments. Download current information provided by physician. Clients can control their own PHRs. Includes information from all healthcare providers, accessible from any time and any place, provides transparency to be able to see who, when, and where the data was entered and who has viewed it, permits an easy exchange of data across all healthcare systems. What can a PHR contain? Drug allergies and adverse reactions, prescription record, lab test results, imaging reports like X-rays and MRIs, family history, illness and hospitalizations, surgeries and procedures, immunizations. Benefits of PHRs. Benefits clinicians in delivering best medical practices, analyzes health profile and identifies potential medical errors, opportunities for improvement based on drug interactions, track illnesses in conjunction with health providers preventing unexpected outcomes. Other benefits include eliminates communication barriers allowing for timely documentations, ease the workflow among patients, physicians, nurses, and other disciplines. More importantly, readily available critical information to properly diagnose and treat. Are PHRs private and secure? Yes. Special permission and password information lets an individual choose who can have access to information quickly. PHRs offered by most companies consist of a secure website. Healthcare providers will provide a privacy notice to indicate how they will keep personal and private information safe. How can a healthcare provider obtain patients' PHR? Authorization is needed prior to obtaining PHRs based on the HIPAA guidelines. Authorization should give permission to release all information pertaining to treatment and care of the patient. There are some PHRs homepage that allows another person to give permission to using the tool, and that particular individual can obtain their own ID and password. Types of PHR: paper, personal computer, internet, or hybrid personal computer internet. Standalone applications available in the internet or seen like on smart cards, CD, or flash drive. This relies on a person to enter their own health information or allow information from a payer to be uploaded or scanned in the system but not connected to a PHR system. Tethered. PHR is linked to a health system that involves access to the patient portal, offers a longitudinal view, non-tethered, designed to accept and integrate information from different sources like health systems, providers, and insurers. Network PHR, electronically view, collect and manage or share health information or process health-related transactions, and these can create a more comprehensive PHR. Types of PHR providers are available and Such providers are employer-sponsored, like Dell and IBM, employer-sponsored, like Dell and IBM, insurance-sponsored, Blue Cross Blue Shield, provider-sponsored, Department of Veterans Affairs, independent products that are offered in the marketplace, which varies in cost. 12 questions to ask when choosing a PHR. Will the PHR provide all the information I need for a complete health history? Will information be automatically added to the PHR from any other records like insurance, employment, or care? If so, what information will be added and how will it be added? Is the information transfer audited? Do I have the opportunity to delete, correct, or add information? How will I do this? Does the PHR sponsor have any ownership rights to the collected information? Can the PHR sponsor sell my information to anyone or for any reason? If so, how can I protect my privacy? Can I specify that my information not be sold? Will my information be used for employment or insurance coverage decisions? Who has access to to the information in my PHR? Can I choose to give my doctor, dentist, and other caregivers access? How do I control the sharing of my information? How will my information be protected from unauthorized use? If I am no longer employed insured by you, can I still continue to use the PHR? How can I transfer my information to another PHR sponsor, like a new insurer or new vendor? Will there be any cost for me to have a PHR with you? For instance, are there fees if I give my doctor, dentist, and other caregivers access to my PHR? These are listings of some web-based providers that are free of charge. iHealth Record, Emory Stick, About My Health, Medical Alert, My Connect, Microsoft Health Vault, It Runs in My Family, VIA, Zebra Health, My Health Folders, Avado, My Docupedia PHR, My MedWall, Patient Power, DLife, Remember It Now, Serena Health, Juniper Health, and these resources can be found at www.myphr.com. These are some links of a few mobile PHR apps that are available. 15 mobile apps for better health, chronic condition management apps, GetJar mobile health app database, Haptik mobile health store, iTriage, VA mobile health journal app, NextGen mobile, T2 mood tracker, Vobia's text for baby, and these are also available at www.myphr.com. Now, where do we go and get started on the PHR? Their sample forms are available on www.ahdionline.org. Also, forms are available through your physician, internet, and pharmacies at www.myphr.com. Now, I hope this presentation was helpful, and now you can see the benefits outweighs the odds in having a personal health record. Now, what's keeping us from starting one? Let's go do this.